Okay, so hello, I am Christina. Welcome to my YouTube channel. This is my first video. So this video is about the IUD insertion, the Nexplanon. I've heard good and bad reviews about it. And my sister personally recommended it to me because she said that it was a good it was better than what you call it? Why am I about to say ibuprofen? It was better than the Depo shot because currently I do have two boys, and I was on the Depo shot twice. The first time I was on the Depo shot, and I was actually on my period, and with his father, we had been having intercourse, like regular, every other day, whatever, and we separated, due to an abusive relationship, from him, but back to birth control. One day, me and my mother, we went to Red Lobster, and I ate some shrimp. It was shrimp scampi, and I remember my stomach hurting really, really bad, and I was just like, Mom, like, okay, my stomach hurts really bad. I'm not sure what it is. And sure enough, we ended up going to the emergency room, and I found out I was pregnant. And I was 5 months pregnant at that, almost 6 months, like a week away from being 6 months pregnant. And I wasn't even showing, so I didn't know. Second time around, the shot, I got it in my butt. So the first time I got it in my arm, second time I got it in my butt, and it didn't work at all. So this time around, my sister also recommended it to me because we all have pretty bad cramps. So, and my doctor also told me that, it helps with cramps. So I recommended that as well, and it lasts up to 3 years. Usually, well, they said it lasts up to 5 years, but they recommend you switch it out every 3 years just to make sure, nothing goes wrong and that it doesn't misplace itself, because sometimes it can, like, attach itself to your skin inside and then migrate around your body. But, you just can feel it in your arm, and she let me feel it in the insertion. So basically, when I went in there, did a urine sample, and then waited in the lobby again, and then they called me in there, and then they told me all what, they told me, like, like, I could have, like, irregular periods, or I could have regular periods. It just depends on your body, and every person is different. Everybody has different DNA, so you never know, if you'll have long periods, short periods, whatever. It doesn't matter who you are. It's up to your body. Your body responds to it differently. So basically, again, upon me getting it, she rubbed my arm with a cleaning solution, and that was like an orange color. And then she rubbed it again with she had a needle, and she had it was like this much of clear fluid. It's called lidocaine. It's like a numbing solution. So when she first started to do it, it kind of tickled to me, honestly. And then 3 to 4 seconds in, it started burning a little bit, but it wasn't like a burning sensation like, oh my god, like this burns, like, like a latex reaction or something, or like a fiery sensation. No, it was just like as if somebody had like a sewing needle or something, and they kept going like this to your arm, and it's not going through, but you can feel somebody doing something. But of course, the lidocaine, you have to put it in with the needle, whatever. So after that, like, it was done and over with, and then she let that sit like a couple seconds, and then she brought the it's like a little white thing. It's like maybe this long, It's it has the implant in it. So she put it to my arm, and it has like a little sharp ending, so it could go into the hole that she made. Cause she made like little two little dots with the marker to see exactly where she's gonna place it, and she measured it. And I forgot to say that before. She measured it, and it was like a 4-inch space between like where she measured. So then when she slid the little device up, and you can feel the device go, but it's like you can feel it on the outside of your skin, like not going inside. You can't feel it going in at all. And it's kind of like somebody touching you, but you feel like they're touching the air, but they're not touching you, you know? So, and then she slid it in, and then she was like, okay, we're done. And I was like, oh, really? Like, that was quick. It didn't even take 10 minutes, really. And she had a big swab, and she patted it, put pressure on it so it'll stop bleeding. And then she put a Band-Aid over the hole, and she said, keep that bandage on for 3 to 5 days. Don't get it wet whatsoever. If you have to take a shower, cover it up. And what else did she do? Oh, then she put the it's like a gauze wrap on over the Band-Aid, just in case anything gets out so it doesn't get infected. And then she wrapped this green bandage around my arm, and with a pressure, of course. And she told me, just don't get it wet, and if she wrapped it too tight, I can loosen it up a little bit, but just for 24 hours keep it like this tight so that the pressure is applied. And don't do too much with this arm, because this is my dominant hand. I am right-handed, so they put it in the left hand. Whatever hand you're dominant, like that you use dominantly, they put it on the other arm, the opposing arm. So yeah, it was pretty quick. Like, I was nervous when I went in there, of course, because I heard all the bad reviews and stuff, but I did hear some good reviews. And I personally think, from my experience, I went to Planned Parenthood, so I felt pretty safe going there, because I knew, like, it wasn't like they're not gonna play around. They know what they're doing, and they're serious about what they do. And the lady was really nice, and she talked to me the whole time to make me feel comfortable, and she just was really nice, and she had an assistant there watching, so just in case something happened, the other lady there, is there to help or assist her. And yeah, now I'm out sitting in my car, and I'm about to go to my next appointment. So I have x-rays, and that's another video, basically trying to figure out if I have rheumatoid arthritis or arthritis at all, because I just been having like a lot of joint pain, stress, everything. So yeah, but thanks for watching my video. Hi, I am Christina. Nice to meet you. This is my first YouTube channel. Hopefully I get lots of views and subscribers, and please do subscribe to my channel. I would love for you all to come back and watch me, and chit chat with me. I could do daily vlogs, whatever you like, just ask.